Morning, good afternoon, and good evening, everyone. My name is Carol Kamasaka. I work with PATH as Senior Program Officer for Digital Health. I'm here to present my leadership project on supporting women to strengthen healthcare delivery through digital health integration. Women are underrepresented in healthcare leadership, and this also leads to limitation in the leveraging of digital solutions to deliver healthcare at their levels of service. So my plan under this leadership project is to develop a targeted training and capacity building plan for female health workers that will empower them and improve their skills in ICT and eventually improve healthcare delivery. The intervention is a targeted training program for the female health workers, with major outputs being I look to produce one set of training materials targeted for the female health workers. A curriculum focusing on female health workers' needs will be created, and also training 150 female health workers on the use of digital health tools. The outcomes of this will be an increased acceptability and usability of digital health tools at last mile level, improved health service delivery, and enhanced knowledge sharing of the health workers, plus inclusion in leadership. These are the phases of implementation and the milestones so far. Phase 1 included stakeholder engagement. We have engaged the Ministry of Health and the district health leaders on the project to get support and buy-in, which has been achieved. Phase 2 included capacity needs assessment of the existing training materials, which I have done and identified the existing gaps in digital skilling and the resources that are required. Phase 3 will look at developing training materials and piloting the program, and the results and feedback from the piloting program will help to refine the training materials, which will later be approved by the Ministry of Health as working tools for the Ministry of Health. Then phase 4 will involve a hands-on training for the trainers, plus the eventual on-site training of the female health workers at the places of work. And lastly, phase 5 will include monitoring and evaluation to assess the impact of the leadership project. The next steps for this is to finalize on the location and identify the trainers and the trainees with the Ministry of Health, identifying gender experts for content development of the training materials and curriculum, piloting the program, and onboarding the trainers for broader capacity building. The challenges faced and proposed solution. I've had a challenge in lack of financial resources that are needed to implement this program, but I'm looking at establishing funding partnerships and exploring grants and sponsorships. There's limited access to training infrastructure for remote training, but I'm exploring alternative platforms through which this training can be delivered. There's been a delay in identifying the implementation location, but I am doing continuous engagement to expedite this process. The impact in terms of authenticity, the project is grounded in personal values and transparency. It aligns to national and health sector goals and objectives in the country. The impact is aiming for measurable improvements in healthcare delivery, and in terms of inclusivity, there's promotion of diverse voices in project planning. Thank you.